that you can use for lights.
Minus storage.
Yep. Nice and bright.
Yeah.
The beauty of this one is if you press the button twice, it goes into strobe mode.
Oh. It looks like Lady Gaga.
Thank you. That's the best compliment I've had all year. But the beauty of that one is you can use that to signal for help.
Yeah.
Fire brigade's trying to find your facility, send somebody out wearing this, put it in flash mode, they'll find you pretty damn quickly, right? Like late at night, these buildings aren't easy to identify. They can look like a block of units, they can look like a block of apartments. There's one that we do at Rose Bay where you think, oh my God, that's a beautiful block of apartments. And having someone go outside and wear that with the flashing lights, really, really helpful to the fire brigade. Everybody pop up again. Everybody turn in. So look at that door. We've got one of these green signs. Okay, these are called emergency exit signs. And they changed a few years ago. So they're always in this pictograph style because the thinking was not everybody can read English. Okay, so no use having exit. So they have this symbol called the running man on it, and it's important to understand how to read these signs. So if that one's there, what do? What direction do we go? Which way? So who thinks we should go right? Because the running man's going to the right. No? Who thinks we should go straight ahead? That one's actually telling us to go straight ahead. So here's our fire door, here's our exit. There's safety out there.
Yeah.
Notice this one's got an arrow on it.
Yeah.
So if it's got an arrow on it, that's when it's telling you to turn. Whatever direction the arrow is, turn right or turn left. If there's no arrow like this one, it's telling you to turn straight. Don't get confused by this man running to the right. It's a little bit silly, isn't it?
You're not so confused.
Then the final thing that we've got in our safety equipment is the emergency flip chart. This is exactly what its name says it is. It tells you what to do in an emergency really, really quickly. So we did the training today. You've done the fire safety training. Andrew goes, they're a fantastic bunch. They're super intelligent, super engaged, listen to everything that I said. I know they understood what they should do. I go away, and then there's a fire and you go, what are we talking again? What do I do again? Just go to the tab, the red one. Fire emergency. Race and pass. It's there. It's to help you when that adrenaline is rushing. You may be not thinking clearly, but you've got other things like personal threat. So if somebody's an intruder got into the facility, they want to get to the drugs cabinet, this will tell you what to do. There's a bomb threat. You've got missing residents. You've got medical emergencies. So the medical emergency, for instance, say that unfortunately I had a heart attack right here. Would you know what to do? Save me! Save me! That's what you're going to do. Someone needs to start CPR. Someone needs to get the defibrillator. Someone needs to call the ambulance brigade. Oh, sorry, the ambulance service, right? But a medical emergency will have things like what your nearest hospital is, so whether it's Concord, whether it's RPA, whether it's Canterbury, Bankstown, that sort of thing. It'll tell you who your attending doctors are. If you had a power outage, and it will tell you your utility supply. So say it's Osgrid. You could ring Osgrid and say, hey, we're Gundi nursing home, it's 2 o'clock in the morning, we've had a power outage. Osgrid says, yes, we know, it's affecting the whole of Stratford, but we'll be right there to help you, and we will prioritise the nursing home coming back online as quickly as possible. As opposed to a resident who's playing their computer game at 2 AM and says, hey, I'm in the middle of my computer game, I'm about to hit a higher score, can you help me? And I said, bad luck, right? Okay? So these are really handy. And I've seen them everywhere in my jobs previously, but I didn't take a lot of notice of them, I've got to say. So after the session today, if you're walking past one, look out for it, have a look at it, see what it says. If you don't know what it's telling you to do in a certain situation, just ask one of your colleagues for help, someone who knows about it. And these are site-specific. We don't just take this one from Gundi and take it to another facility. It's got your specific information in it. Okay? So that's the end of Module 1, Fire Safety Awareness. Do we have any questions? Making sense?
Yes.
Anything I said that isn't making sense? Confusing you? John, you still awake? You look pretty tired. Need to open up the door to get some fresh air? So we're travelling pretty well in terms of time. So we've done an hour. The next module is actually what we call resident removal techniques and evacuation procedures. What do you think of when you hear the word evacuation? If you need to describe evacuation to me, what would it mean to you right now?
Getting people out of the building as quickly as possible.
Getting people out of the building?
Yeah.
The building as quickly as possible?
And taking the easy ones first and the other ones, you know.
What about if you're on a boat and someone says, we need to evacuate? What would that mean? Throw the life rafts over the side, jump in the life rafts? It doesn't. Well, people would think of that. It seems strange that I'm asking that question, but evacuate literally does not mean put them out of the building. That's one option. What it means is take people from a dangerous place to a safe place. So we do different levels of evacuation that we'll talk about in part of this. Remember, your facility is very, very safe. It's because you've got the compartments. If the compartment's closed off and the fire's inside it, you move to the adjacent safe compartments. If the fire progresses, you move to the adjacent safe compartments. You're always running away from the fire by putting a barrier between yourself and the fire, using the design of the building. These buildings are brilliant, they really are. They've got special plaster, they've got special paint, they've got special carpets that don't catch fire easily, or if they do catch fire, they don't burn very, very well. Plus you've got all the fire suppression equipment that we've talked about. Then you've got the compartments to contain it. So earlier on, I think I said that if there was a fire here today, we're safer being inside than outside. So in a fire, you're not evacuating outside unless the fire brigade arrive and says you do need to evacuate outside. You're staying inside. Internal fire, external fire, stay inside the nursing home. So evacuation means move from dangerous area to safe area to move people. Stage 1 evacuation simply means get out of the room. This room's on fire. Stage 1 evacuation, I go through the door. And the next thing I do is I can find the fire. I close the door. Oh, wait on, I left 7 people in here. Very selfish of me. But if this is a resident's room, all you have to do is get the resident and or any visitors in their room outside the door for stage 1 evacuation. Remembering that you want to look for people that might be hiding. Stage 2 evacuation is when you want to get people out of the fire compartment or the fire zone. So normal door here, we go through this normal door, but we want to continue our journey to safety by getting out of the fire compartment. So what are the next doors that we would go through after this one? So say there's another layer of doors. What sort of doors would they be? Smoke doors. That's what creates the fire compartment. Remember, the smoke alarm activates the fire indicator panel. And all the smoke doors closed, so it'll be in a box. So a stage 2 evacuation is moving outside of that fire compartment. We're in zone 7 training room. Stage 2 evacuation could mean, let's move to zone 8, or zone 6, or zone 9, or zone 11. That's the stage 2 evacuation. Then the stage 3 evacuation, you would only do it under certain circumstances here. One could be an earthquake if there's structural damage to the building. You could have a bomb threat you've got to deal with seriously, so you might move people out in that situation. You could have a flood internally, for whatever reason, the water pipe's broken. You would consider moving people outside. But think about the nature of the people that live here, your residents, they're elderly. They have poor health, right? We put them outside when it's raining and it's cold, they're going to get exposure. They can potentially get pneumonia and die from that. You put them outside on a hot day, they can get heat exposure and die from that. It's safer for them to be inside, so only move them outside for stage 3 if it's absolutely necessary because of the type of emergency or because the fire brigade tells you to. They'll be here in 9 minutes. That's what this training is about today. You really have to think about what you need to do for 9 minutes. They'll arrive and take over. Perfect, that's what we want. So John, I think, started talking about the the evacuation priority, who we take out. Do you want to just tell me again?
Yep. The ones that are easy to take out for you.
Yep.
Instead of running to
someone is incoherent or doesn't want to come has been difficult because it's not worth risking alone.
So we have a priority evacuation that we follow so that we can do the most good the most quickly, save the most lives. So we take out the residents or visitors that are ambulant. Now, ambulant normally means I can walk around unimpeded, right? In a nursing home setting, you've got the complication of cognitive function as well. So somebody might be physically capable of walking out, but they're not compos mentis enough to follow instructions to say, Andrew, I need you to leave the building, can you find your way out the front door? Sure, I can do that, don't worry about it, front door's over there. Bang into the wall, right? I'm not ambulant in that situation. So you need to understand your residents, what their capabilities are. The second priority that we'd be going for is what we call semi-ambulance. Now that could be someone who's got maybe a hip injury and needs a limp. They would normally have a walking frame or a walking stick. Or they're physically capable, but they can't follow direction. They're your semi-ambulant. The third one is what we call our non-ambulant or bedridden. And there's a special technique we have for getting them out of a room or a fire compartment. Does anyone know what the technique is?
Blanket?
Yeah, exactly.
Blanket.
Yeah. The technique's called the blanket drag. So you know the floor surface in the nursing home is pretty smooth in most locations except where you've got carpet. You've got somebody who's stuck in their bed either because of their physical incapacity or their mental incapacity or a combination of both. There's no way that you can assist them out as a walking resident. You need to get them off the bed onto something that you can drag them out of the room. Now it's called the blanket drag, but you could use a cotton sheet off the bed as well. Blankets are just more robust than sheets, so preferably a blanket. How you get them off the bed doesn't matter. If you need to be a little bit rough in terms of levering them off, maybe dropping them a little bit, that's okay. The important thing is to get them onto the blanket so you can move them. And then the technique for moving them out is very simple. And we're going to demonstrate this a little bit later, have to practice this one a little bit later on. You lay the blanket on the floor, and one person can do this technique, or two people can do it together. It's quite simple. Can you be my volunteer patient? Just lay down with your head down here.
Lay down.
Head down this end, so put your feet that way.
Oh, don't be patient.
And just have a nice little rest there, okay? You comfortable?
Yeah.
Do you need a pillow?
No.
Okay. So the technique is, you've got the patient on the blanket, you get the corners, and you just roll the corners a little bit to make it like a rope-like structure. The beauty of that is you can then wrap it very solidly around your hand. Both sides. You've got to be careful if your back is doing this, right? You want to use the right technique. So you bend at the knees and you bend at the waist. And that puts you in a very strong position. And then you put your elbows into your abdomen. So that locks your core. And what you're doing is you're using your hip muscles, your leg muscles, and not your back muscles to do it. And then simply, when you're ready, you start walking backwards. And the patient slides very, very easily across the floor.
Bye.
Then you come up. So it's a really effective technique. Essentially over around the room, 10 seconds, 15 seconds. That's the blanket drag, so that's the right technique. We'll have some practice from later. The final class of patient is what we call our non-compliant or resistive residents. I'm sure you've all got one, maybe two, maybe more residents who on a day-to-day basis aren't as friendly as you might like them to be, aren't as helpful as you might like them to be, and aren't as cooperative. The possibility is during an emergency situation, they're not going to follow your instructions. So what do? Andrew, we need you to leave the room. It's on fire, you're in danger. Can you please come with me? No, go away, I hate you. Okay? What are you going to do? You're going to grab them in a headlock and drag them out of the room? Pull them by the hair?
No.
So what are you going to do? You're going to ask them again, Andrew, I repeat, you are in danger. I need you to evacuate from the room with me. Can you please come with me? No, I don't think there's any danger. I'm quite happy staying here. At that point, you leave them. Your life is the priority in that scenario. You cannot use any physical means whatsoever to get them out of the room. because you could be up on an assault charge. Now, what you do is you let the people in the fire response crew know that you've got a resistive resident in danger in the fire zone. So in the evacuation bag, we've got the walkie-talkies. Trevor's going to play the emergency coordinator. I'll play the fire crew that's leaving the resistive resident behind. Fire crew to emergency coordinator. Over.
Emergency coordinator, the fire crew, pass your message. Over.
I'm in Zone 7 training room. We have a small fire and a resistive resident who refuses to evacuate. I'll be leaving the room. The resident will stay here, but we need to let the fire brigade know. Over.
You wouldn't believe it, the fire brigade have just arrived. I'll send them straight to the training room now, where one person's still in the room where the fire is. Over.
Fantastic news. Thank you. Over.
6 kilometres.
No.
Brilliant.
So that's fantastic. The fire brigade can then come in and remove the resident using whatever techniques that they like. They can throw them over their shoulder, they can grab them by the feet, by the shoulders, take them out that way. That is their job. They are trained in doing it, and there's no legal consequences for them doing it. That's their expectation. So let the professionals do their job. Okay. So we've gone through the staged evacuation, out of the room, out of the compartment, and out of the building. We've talked about the evacuation priorities, so taking our ambulant, semi-ambulant, our non-ambulant, using the blanket drag to get our non-ambulant out, and then how to deal with a resistive or non-compliant resident. I'm going to talk in a minute about the fire or the emergency coming to its conclusion and what you want to do to return to operations. This evacuation bag, you're probably already familiar with it from previous training sessions that you've done here. What's the most important thing that's in this evacuation bag that the fire brigade may need or will need when they arrive?
The register.
Yep, okay. So there's a number of items. There's a first aid kit, bottle of water. We've got the walkie-talkies. You've got the head torch. We've got a thermal blanket. But this item here is the most important one. That's what tells the fire brigade how many residents are currently here in the facility and what their names are and what they look like. So this needs to be kept up to date. It needs to be kept current. If you've got a new resident, they need to go into this. If you've got a resident that's exited the facility for whatever reason, they need to be removed from it. So when the fire brigade turns up and says, we look in the folder, it lists 62 residents. We've got 62 residents in our evacuation area. Everybody's accounted for. That's the perfect scenario. Or this lists 62 residents, but there's one who isn't here physically. Where are they? Ah, that's Andrew. He's in Zone 7 training room. He's resistive. We couldn't remove him. They will then go down. Very, very important piece of information to maintain. Keep it in this bag, and keep this bag light. This is an evacuation bag, or what they call a grab bag. Don't overload it with anything. So you've got the residents, you've got the staff, so you've got your staff list, you've got your resident list. Who else is present on the premises that we might need to take care of? Trevor and I here. You going to take care of us?
Yeah.
Contractors.
Boy, that was a hearty yes. We're going to take care of Trevor and Andrew, wasn't it? I'll ask you again. Trevor and I here as visitors and contractors. You going to take care of us?
Yes.
Oh, slightly more, huh? Gee. How would you look after us? How would you make sure that we're accounted for?
Just immediately sign him and come in.
Exactly. So somebody has to grab the contractor and visitors book up front. Family visitors and also contractors. Same sort of thing. There's 20 contractors on site, they're all accounted for. There's 20 visitors on site, they're all accounted for. 62 residents, they're all accounted for. 20 staff, they're all accounted for. No one is in danger. The fire brigade can then proceed to control the emergency, put the fire out, knowing that they don't have to rescue it because everyone else is safe. So those bits of information, you can see how they all start to interlock and fit together. Very, very important. So we had the fire. The fire brigade has attended. They've rendered the facility safe. They've reset the systems. We want to get the facility back to normal operations as soon as possible. Who are the most important people in the facility that we need to take care of? The residents. So the first step you want to think about is how do you settle the residents? How do you get them back to their normal? So you want to get back to their room if you can. If their room's unaffected, get them back to their room. You want to get them back into a comfortable position, so get them in their bed, if that's where they prefer to be. If they've got any questions about what happened, answer them as best you can, but don't scare them with any unnecessary information. The second thing that you want to do is start the clean-up procedure. The sprinklers may have gone off in here, the fire brigade's attended, they've sucked up as much water as they can, but there's still a bit in the corner, it's a bit mouldy, you want to start cleaning the room up. Or there's been a small fire, you've got smoke against the wall, get a painter in. Or just close the room off until you know what you're going to do. Settle the resin, start cleaning up. Then the fun part begins. The paperwork. You have to fill in two types of paperwork potentially. One is called an incident report, and the insurance company for the facility needs to know what happened. What date was the incident? What time was the incident? What type of incident? What emergency service attended? Where in the facility did it occur? Was anyone injured? Were they staff? Were they residents? There will be a whole series of questions that need to be answered, and for it to be documented effectively for the insurance company to pay out ultimately. But more importantly than the incident report, from a self-interest point of view, is the accident report. How quickly have you got to fill in an accident report if anyone is injured during an emergency, or even day-to-day work? How long have you got?
For 24 hours?
Yeah, less than 24 hours. 24 hours. So if you get injured at work and you decide not to document it for more than 24 hours, so 24 hours and 1 minute, technically and legally, they can say, we're not going to pay you a workers' compensation claim. So if you do the blanket drag, and for whatever reason, you're a very slight build, the patient's very heavy, two of you working together, maybe you did strain your back during the blanket drag. Now hopefully you didn't, because you know the correct technique is to bend at the knees, bend at the waist, engage your core, pull backwards, but maybe you did get a sore back from it. And maybe it happened on a Friday afternoon, you think, nah, it doesn't matter. It's okay, it didn't really hurt, I'm going to be okay. Saturday comes around, your back's hurting even more. You can't play tennis, you can't play golf, you can't go to the gym. Sunday, you can't get off the couch. You come to work on Monday and fill in that accident report, it's too late. Workers' compensation would not pay a claim if you put that accident report in on the Monday versus the Friday. That's your livelihood dollar. You can't afford to pay your rent, you can't afford to put petrol in your car, pay food for your family. It's got some, very, very severe implications for it. So know that 24-hour period is critical for your own well-being to get that information filled out. If you've got any concerns about whether you're injured or not, get medical advice. So the final thing that we want you to do as part of the post-emergency situation is have a staff debrief. So you might all come back together and say, we had the emergency, we've returned the facility to normal, what did we do well, what could we do differently? Did we implement the race protocol? Yes, we did that really well. Did someone try and control the fire? Yes. Did they follow the pass protocol? Were they accompanied by a colleague? Yes, they did that really, really well. What would we do differently? Look, we probably didn't alert the fire brigade as quickly as we could have. We relied on the fire monitoring company. Next time I prefer if someone actually telephones the fire brigade. So you're just using it as a learning exercise. Now we are trying to make what you need to do as automatically for you as possible, but you will likely maybe not remember things. That's okay. Get most of it right and make sure you've got good leadership. And then finally, you want to be taking care of your mental health as well. People respond to difficult situations and emergencies in different ways. Some people are very calm, they're very low on the anxiety scale, things don't faze them. Other people at the opposite end of the scale, they get quite upset by things that other people don't. We are all individuals. Whatever your response is whatever your response is. We need to take care of our health, whether it's our physical health or our mental health. One really good way you can take care of your health is through something called the Employee Assistance Program, EAP. It's a free service provided by the government. It's available 24 hours a day, 7 days a week. It's manned by mental health professionals. But if you contact them, they will listen sympathetically, empathetically to what you're describing and help you find what treatment options are available for you. And it's all confidential. Okay? It does not come back to your employer in any shape or form. So really, really important to look after yourself physically, but also be aware of your mental state. and whether it's not the usual mental state, and whether you might need some assistance. So you can get that through AOP. Fantastic. So we've done the 2 modules now. There's only one left for us to do, and that's part of our evacuation techniques. So we would like 2 groups to actually practice a blanket drag outside the room. So I showed you how to do it. It'll be really quick. It's a role play. People are a little bit embarrassed about doing these things, but they're good fun. And doing it practically is what will cement it in your mind, so that if you need to do it, you know how to do it and do it the right way. So are we okay with that?
Yeah.
All right. So before we do the blanket drag, are there any questions from the information that I've presented so far? No? Let's do the blanket drag then. You're excused because you did it before. So we'll go 3 here and 3 there.
Could you use your phone for video?
Yeah, no problem.
Is that okay?
Yeah.
I'll keep this on here. For whatever reason, it's hot in the pocket, like there's something going on.
You want to be our patient?
Yeah, sometimes I have to speak.
So just say when you head up this end, this time we're going to go out this door. So you lay down with your head up this end and your feet down there. Your head here, feet down there.
Sometimes you don't take the battery out.
Yeah, it's one of the arrow.
Sometimes you make it so it's way out.
That's, oh yeah, that's what they said.
Yeah,
Try another one.
Yeah.
Still years old!
That's why it's a fine and put it in the
Oh, leave it
This
in
end, we're going to go out this door.
Just grab a corner up there each.
You're going to go this corner?
The other corner. Yeah, just grab one corner up there each. Wrap it around your hand. You can twist it first if you like.
Now you're going out this door.
That's it. Wrap it around your hand.
Well, hang on a second.
Okay.
No, wait. Yeah, wait. This one, you're going to go out this door, okay?
Okay.
So
I'm not waiting till he gets to the front. I'll do the door.
you need to be careful going through the door that you don't injure yourselves and you're sticking to the patient.
Elbows in the tummy. Pull your elbows
Bent
in.
knees, bent waist. I will tell you when to go.
Are we right? We're taking it one piece, okay?
Gundi aged care, 24th of October. Blanket drag evacuation for non-ambulance residents. Sorry, that was 24th of October, Gundi aged care, blanket drag evacuation for non-ambulance resident.
Elbows in it, chef man. Elbows in. Elbows. That's it. Yeah. That'll switch on your core.
Yeah.
Like John's doing.
Okay, when you're ready, go together.
1, 2,
And be careful.
Okay.
Okay, boys, go. Watch your backs. Watch your backs. All the way out and then close the door once you get out of there. I want to see it right out of the room. Blanket and everything.
Keep going, keep going.
Keep going. Okay. Keep going. Keep going.
Right, that will do there. And then
Keep
close
on
the door. So you can time yourself by closing the door.
Yes, we got rid of them.
Well done, thank you.
You know, Johnny will do jump his car. No. Did you ever go before?
Sorry.
Okay, give it a go.
Was that easy or difficult?
Easy.
Well done. Well
Thank
done. Well done, Johnny. Good. What he was doing, what you were doing was perfect. Yeah. Well, yeah, that's right. No, takes it off the back.
Who's going to be the patient? Who's going to be the draggers?
Joe, you should be in the patient,
No,
man.
you are too like No, you not.
Looks like you're the patient.
What's
So
that
you
now?
think you're the patient.
Trevor, it's not bedtime, Trevor.
I was really big.
Yeah, no,
Come on,
I'm saying
get
the
out.
carpet is,
Wrap it around your hands, guys.
the carpet is smooth in your front.
Exactly.
1, 2, 3, go together. All the way through the door. Watch yourselves, be careful. Be careful of the patient. Right out of the room. Further, further, further. You can stop now. Close the door and find the fire stove.
Yeah, you little mighty mouse.
Oh, smooth ride.
These women, I don't know, got more strength than men.
Maybe your feet been good.
They got more tattoos than men these days.
Exactly.
Oh, yes, it's an organ.
When you come 80 years old, it's not good.
Ah, you think the same as me? Look straight now, or double straight now.
Well,
You can get rid of that, by the way.
yeah.
They're everything there. Or they put someone's name. You better,
Yeah, you
hope,
see
you
my
better
like-
hope you marry them and stay
I
with them.
just think my old grandmother, like, used to give her a hug. She got a knife and salt.
John, I had to put it, and she got a dick.
A dick?
Yeah. What's up? Got a tattoo dick.
Oh.
What? How did they?
Yeah, she got a tattoo
Oh.
dick. When she was 60, it's amazing what it looked like.
Maybe her husband was called Richard, I don't know.
So one thing left for us to do. A small quiz. We'll take a maximum 15 minutes.
Yes.
You've got all the answers on the bit of paper that's in front of you. So what we'll do is get you to work in two groups, one of 4 and one of 3.
Where's your John?
One person writes, everybody contributes to the answers. We're here to help. What I've talked to you about today, you've taken it in, you'll know what to write on the quiz, or you can refer to that, or you can ask Trevor and I
I'm
if it gets stuck.
What have we got? 1, 2, 3. You want to do one down here? Come one down here. We've got 3. Turn your chairs around and say your group up there. Now, have you got a pen? Good, one pen. That's all you need for your group.
You can use that to lean on, so it's got a hard surface.
Put the facility name on your 24th of the 10th. Print your name and sign it, and together work as a team. If you get stuck, just ask one of us. Same thing. So the facility name, 24th of the 10th. Right? Yep, and the print your name and sign it, and go through here. Together as a team.
That's it from me.
So once you've got all your names and signatures on it, let me know. I'm going to give you help with the first question that I want
There
you
you
to
go. It's
answer.
easier than me. It's going to help you out.
Just with the first question to get you started, but not the first question on the sheet.
We will do the little activation.
Oh, we will?
Yeah.
Okay.
Talk to Gerald and absolutely wrap with what we're doing. So they said you can do it. I said we will be going about 4, so we're still got 5.
Yeah.
How's it going? You really relaxed today. Really good.
Yeah,
Makes a difference.
it's all coming much more automatically.
Yeah, but yeah, it really like muscle memory.
Okay, let's go. John, you got to put your name there, brother. John, it'd be good to know.